Welcome. Hello, everyone. We're going to wait a few minutes for individuals to come and join us. Just give us one moment. Welcome again. My name is Stacey Lawrence, and I'm part of the member engagement team here at Partners. Thank you for joining us today for our monthly Partners Member Cafe. Also joining us for member engagement is Beth Brooks, our behind-the-scenes Zoom guru and question moderator, as well as Karen Sue. I don't think I got the last name right. I should have practiced a little bit more, you guys, who will be discussing one of our topics, followed by Regina Proust, who will bring you the second part of our topic, and then back to me to share partners information, and Lee Gant, who will be entering information into the chat for you to copy and paste. Our topics today are pharmacy benefits and the overview of prevention services and medication safety. Before we go into our session today, let's go over a few housekeeping items. We are offering today's session in closed captioning. If you don't need this feature, at the bottom of your screen, you can simply hover over the live transcript and click the Hide subtitle. This meeting is being recorded, so that means please do not share any sensitive personal information during the call. Partner staff is available for individual issues you may want to discuss. We will share contact information for member engagement later in our presentation. The recording of this session will be available on our website at www.partnersbhm.org. That's www.partnersbhm.org. Under the member tab, select events and trainings. We will also be sending you a follow-up email with the slides. We want you to be as informed on this as possible, and it could be a lot to take in all at once, so please feel free to review the slides again. Let's take a look at the Zoom features located at the bottom of your screen. Chat is disabled for this session, which means you will not be able to put in a chat, but the question and answer is open for you. So the Q&A is open for you to enter questions as information is being presented. We will monitor questions at the end. There's reactions. It is available for you to raise your hand during the question time, and we will open your mic for questions and or comments. All right, first up, now I'd like to introduce our first guest speaker, Karen. Karen is a pharmacist with the privilege of 22 years of experience in a variety of pharmacy settings, including inpatient hospital, LTAC home infusion, community pharmacy, commercial and independent, NC Medicaid and care management. Prior to joining Partners in July of 2022, she spent the last 13 years of her career as a network pharmacist and then executive director of one of the former networks associated with Community Care of North Carolina. She grew up with a cousin with an intellectual or developmental disability, so IDD, and a sister with persistent mental health issues that affected her family dynamics greatly. She is excited to work at Partners and use her pharmacy, business, and care management knowledge to assist members who are at the greatest risk while also being the most productive. All right, take it away.
Thank you, Stacey. Good afternoon. Once again, I'm happy to be able to speak today. My name is Karen Cease, and I am the Senior Director of Pharmacy Services at Partners. We want to welcome you and say hello, and we're thank you for taking time out of your day to join us. And I'm going to go over some of our pharmacy benefits for partners. So in this session, we'll cover the pharmacy benefits available to the tailored plan members with Partners Health Management, as well as the lock-in program. I'll review co-pays and provide additional information on where to help you find answers should you have questions after this. So what are the included benefits within the pharmacy program? In the tailored plan, a member's physical health, behavioral health, and pharmacy needs are all managed within our one plan with Partners. Pharmacy benefits are for members with Medicaid and include prescription drugs, insulin, and other diabetic supplies like their syringes, test strips, lancets, and the pen needles, as well as smoking cessation agents, and a number of very limited over-the-counter products may also be covered as well. So what are the included benefits? The included benefits are emergency contraception. Some medications will require members to try another product first on the preferred drug list. So the preferred drug list is one component of the formulary with North Carolina Medicaid. And so in some cases, there'll be what's referred to as like a step approach, where you have to try a product on the preferred side before you can get products on the non-preferred side. And sometimes it's just one product, and in some cases, it's two. In addition to that, some medications may require additional information from a member's prescriber. And this additional information is called a prior authorization, or you'll hear, if you're in the pharmacy, you'll see they're waiting, they might say they're waiting on a PA. And that has to be filled out and approved according to North Carolina Medicaid's requirements before the medication can be filled at the pharmacy. And I do want to take the time at this point just to remind everybody that Partners has a tailored plan with North Carolina Medicaid. We have to comply with all of the rules that the Division of Health Benefits pharmacy team puts in place for that. So we're following the same rules as the other plans, the other standard plans, and the fee-for-service Medicaid Direct. Okay. So another component I'd like to review today is, what is pharmacy lock-in? So now that we've covered the pharmacy benefits, I want to briefly go over what the pharmacy lock-in program is. This program helps identify members who are at possible risk for overuse, improper use, or an overdose risk with the use of pain and nerve medications. It helps to identify members who get the medications from more than one prescriber. If the member qualifies for this program, Partners will only pay for pain and nerve medications when your medications are ordered by a specific lock-in prescriber and filled at the specific lock-in pharmacy. When a member is selected for this program, they are afforded the opportunity to be able to pick their prescriber and their pharmacy from within our tailored plan network of providers. In addition to that, this program is really about making sure we're keeping people safe, that they have the access to the medications they need. You'll notice in here, this is talking about pain medications. This is going to be talking about medicines that make you, that help when people are anxious. It's not that we don't want members to have those medications. We just want to make sure that you get them safely and that the prescribers are monitoring and making sure that the member has what they need to safely have these products. Once you are, I wanted to just give a few more details around how this program worked, but I think we'll move on to the next slide to do that. So how's this process work? So if you qualify to be in this program, in the narcotic lock-in program or member lock-in program, you will be in the program for a 2-year period. Information is sent out prior to the program initiation. The members have not only the opportunity to choose their lock-in prescriber and their lock-in pharmacy, but also provide other additional information before the decision is made around medical necessity. And those decisions can be appealed from them Currently, our program is running based on the data that North Carolina Medicaid provided to us when we launched on July 1. And we are now in the process now of beginning the narcotic lock-in program as a tailored plan. So we, over the next 3 to 4 weeks, we will have letters going out to members if they meet the requirements for this program. Okay, we'll move on to copays now. So we comply once again with the same rules and requirements as North Carolina Medicaid for our pharmacy copays. So what is a copay? A copay is a fee you pay when you get a certain level of healthcare services from a provider, or you pick up a prescription from a pharmacy. For North Carolina Medicaid, for doctor's visits, non-emergency and emergency department visits, optometrists, optical, outpatient visits, podiatrist, the foot doctor, chiropractic visits, those are all $4. Now, for prescriptions, generic and brand name, the prescriptions are $4 each or up to $4 each. For some medication products that have been around for a number of years that are so affordable, you may have a copay that could be $3.60. So it's up to $4 unless you're in an excluded group. And we're going to talk about one of the times when there's no copays. So when are there no copays? So this is a very long, large laundry list of what do we have for different types of copays. So before I go through the list, I want you to think of it in terms of, it could be based on a member's age. It could be based on the category or the group that the member is under, what type of services they're getting. It can also be based on a group or a therapeutic class or a class of medications, a specific type of medications, or it can even be a specific medication itself. So let's go over this list, keeping that in mind. So members under the age of 21. So pediatric members do not have copays on any of their medications. Services related to pregnancy, childbirth, and postpartum care, to include prenatal care, there are no copays on their medications. Members receiving hospice, federally recognized travel members or members receiving services through the Indian Health Services or IHS. Members enrolled in the breast and cervical cancer Medicaid through the North Carolina Breast and Cervical Cancer Control Program. Members residing in an institution who receive their coverage for cost of care as part of that institutional stay. Members in foster care. Members that have behavioral health, IDD, or TBI services. Members enrolled in North Carolina Innovations or the North Carolina TBI waiver programs, and reminding everybody TBI is traumatic brain injury. Members enrolled in the Community Alternatives Programs for Children or CAP-C, and disabled adults or the CAP-DA. Members enrolled in long-term services and supports. Family planning services. Services covered by Medicare and Medicaid. So it is possible to be a member in Partners Tailored Plan and have either a primary commercial insurance or also have Medicare, in which Partners, as the Medicaid Tailored Plan, will always be the payer of last resort. Adult vaccines and vaccine administration, no copay. And then lastly, we get to a category around medications. And so it says HIV antiretroviral medications. So there's no copay on the HIV antiretrovirals. And since this slide was created, the North Carolina Medicaid has also done some other updates. So most recently, products that are used for opioid dependence, naloxone that you would use for a potential overdose reversal, as well as nicotine replacement therapies like the patches, the gum. Those are also now $0 copays with North Carolina Medicaid, and thus with Partners Tailored Plan. So this is kind of a summary of what we talked about. So people living in an institution that are receiving the coverage of cost of care, there are no copays for them. Behavioral health services, I reviewed certain programs, talked about vaccines and some of those specific medications, including the newer ones. Our intellectual or developmental disability IDD services, our traumatic brain injury services, Those are all no copay categories. And a reminder, a provider cannot refuse to provide services if a member cannot pay the copay at the time of service. North Carolina Medicaid expects in that scenario for the provider to set up a methodology to be able to bill the member later. So that you should not be turned away if you can't afford your copays. It is the expectation of the provider to be able to set up a payment plan for that, and then do that process accordingly. I will tell you the reality of in pharmacy is that in large commercial retail settings, there is not an easy methodology to do that. If you think about it, years ago, if you went to a store that was privately owned by a family and they ran you a tab or kept you a bill and then you paid it as you needed to. Today's society with computers and some of these larger institutions aren't really set up for that. So if you are a tailored plan member and you are having a copay issue, please make sure that you reach out to your tailored care manager if you're a part of TCM, and they can help you explore what options are out there or working with your providers. I can tell you it's not something where we are not permitted by North Carolina Medicaid to just say, okay, you don't have to pay your copays. That's a requirement as part of the state requirements. So I just wanted to make sure everybody understood and it was clear that it's not that I can say, okay, don't worry, you won't have to pay your copay. We don't have the authority by which to do that. The last thing I want to go over is where to find help. So we want to make sure that you know where the information is and that you can easily find the information around the pharmacy benefits. The member handbook, we have the website link on here for the member handbook. Member handbooks were mailed to members and the handbook is available on our website. And I just saw the link pop up for everyone. Visit Partners Tailored Plan Pharmacy webpage. The pharmacy webpage has all the links to the information for prior authorizations, as well as the criteria for the authorizations. I really can't encourage everybody enough that in present day with all the things going on, and if you're not feeling well or you're taking care of a member, you're a legally responsible person or guardian taking care of a member that needs services, that if you're needing assistance with pharmacy, we're happy to help you with that. But working with your tailored care manager is a great way to make sure that you all have what you need for this. The pharmacy line was just placed where you all can see it. And the pharmacy line is available 24 hours a day, 7 days a week. Our pharmacy customer care line is run by our pharmacy benefits manager, and that's the processor. So it is CVS Caremark. That does not mean that you have to get all your prescriptions filled at CVS. You have the right to choose whatever pharmacy you want. They just help process things behind the scenes. And then you're always welcome to call member and recipient services at the 888-235-4673 number. If you have questions about copays or you have issues with your primary care provider around accommodating special needs, or if you need help with changing your primary care provider. So there's several areas to help you with that. So we are to the end of mine, and I'm going to turn it back over to Stacy that's going to review with everybody about how to ask questions. I want to thank you for your time today and let you know it's a pleasure to serve you. Thank you.
Thanks so much. So just a reminder, it says questions on our next slide, on this slide. We are not taking questions out loud at this time. However, please, we welcome you to put them in our Q&A. And at the end of the slides, we will come back to the Q&A section and we will moderate them accordingly. So please don't hesitate to reach out to ask the questions, but please just put them in the Q&A area. So next we're going to have Regina. So now, as I introduce Regina, she is a certified prevention specialist in the state of North Carolina. She has been in the substance misuse prevention field for over 19 years. Regina is currently a program manager for Insight Human Services, which is based in Winston-Salem and serves 18 counties for prevention services in North Carolina. So out of the 100, she serves 18 of those. She manages several grants in Iredell, Yadkin, and Surrey counties. She is also a member of numerous coalitions and collaboratives throughout the county she serves. Regina, take it away.
Thank you, Stacy. I appreciate it. Like Stacy said, I'm Regina Probst, and the counties I serve are Iredell, Yadkin, and Surrey. And we're going to talk a little bit about prevention and medication safety. So I'm going to go over a little bit about Insight Human Services, what is prevention, and then we're going to talk about the Lock Your Meds campaign and why it's important. So this is our mission, vision, and values. Insight strives to offer the highest quality care to reduce the negative impacts of substance misuse and mental illness in the communities we serve. Our vision is to offer hope, help, and healing to people, families, and communities. And our values are collaboration, integrity, stability, and quality. So we are a nonprofit organization. Like Stacy said, we're headquartered in Winston-Salem, but we provide effective intervention and treatment services in over 60 counties in North Carolina. And then our prevention specialists deliver evidence-based strategies in 18 counties in North Carolina. We believe prevention is about empowering communities to live healthy, happy lives free from substances. So what is prevention? Prevention for us, we have highly trained prevention specialists that build healthy community relationships, providing evidence-based prevention programming and strategies to prevent the early onset of substance misuse. And so these are some of our initiatives. We have coalition development. We work with a lot of coalitions and collaboratives and other community groups on strategic plans and help them implement projects in their community. We also do a lot of community engagement. So we're at different events and presentations and things going on in the community. We have youth prevention education, which I'm going to talk more about in a few slides. We do policy change. So that might mean that we work with a school on giving them lock boxes so that they can give to all of their schools to provide those for teachers when they go on field trips to lock up student medication. We may work with them on reviewing and revising their vaping policy in the school system. So things like that. We also have awareness and media campaigns, and I'm going to share one with you today, which is called Lock Your Meds. And so these are the counties that we serve for prevention. And as you can see, Partners covers Iredell, Yadkin, Surrey, Davie, and Forsyth. And then the other local management entities or managed care organization counties we serve are through VIA, Alliance, and Trillium. So youth prevention education. We use state-approved and evidence-based curriculum. These are the four main ones that we use throughout the 18 counties. HALO, which is Healthy Alternatives for Little Ones, is really geared towards the preschool age, 3 to 6 year olds. And that is a 12-lesson program. And it's really teaching the kids about making healthy choices. And it's very interactive. And that can be used in preschools, daycares, Head Starts, places like that. We also have Life Skills and Too Good for Drugs, which are similar programs, but slightly different. Too Good for Drugs is a little more interactive, and they both cover social skills and other skills that students need to make healthy choices in their life. Life Skills is geared for 3rd through 8th grade. And the lessons vary based on grade level. So some grade levels only have 8 lessons, while others have 16 lessons. Too Good for Drugs goes from kindergarten all the way up to 12th grade. and that is 10 lessons all the way through. And each grade level is age appropriate. So they have a curriculum to use with each grade level. And then Catch My Breath is a vaping prevention program. And that's 4 lessons. That's 5th grade through 8th through 12th grade. And so all of these programs, like I said, they can be implemented in schools with after-school programs, summer camps, faith-based organizations, and other youth-serving organizations. And all of our staff are trained to teach these curriculum. So these are just some of our collaborative efforts. So we work to effectively plan community events and presentations. We do medication chemical disposal distribution, which I'm going to talk more about in a minute, as well as lockbox distribution. And then we also do community needs assessments. So we work, because we are state funded, we have to complete a needs assessment every 4 years. We actually just completed our most recent one in February. And that's where we work with community partners and community members to find out what the real issue is in that county as it relates to substance use. So we are able to determine the top concerns for the county, why is it a problem in that county, and what can we do to address it. So we're able to then pick strategies that best fit that community. So the Lock Your Meds campaign is a national campaign developed by the National Family Partnership, and it was adopted in 2017 by the North Carolina Department of Health and Human Services. These are just some examples you may have seen on billboards or on social media or in newspaper ads. So we're going to talk about why it is important to address prescription medication misuse. So many people believe that prescription medications are safer than illegal or illicit drugs because they are prescribed by a doctor. However, if they are not used as directed, these medicines can be just as dangerous as illegal drugs. In fact, overdose is the leading cause of unintentional injury death, second only to motor vehicle crashes in North Carolina. And many overdose deaths in North Carolina are medication related, occurring when people misuse their medications. And this is just some drug overdose death. It doesn't mean that it's specific to prescription medications, but overall for North Carolina, in 2022, there were over 4,000 North Carolinians that died of a drug overdose and almost 17,000 drug overdose emergency department visits that were in 2023. And from 2000 to 2022, there had been over 37,000 lives lost due to drug overdose. And then according to the CDC, over 111,000 drug overdose deaths occurred in 2022, and over 84,000 of those involved opioids. So that can be either a prescription opioid or an illicit opioid like heroin or fentanyl. And then it decreased slightly in 2023 to 107,000 drug overdoses, and 81,000 of those involved opioids. So this is the first decrease that we've had since 2018, which gives us some hope that things are declining. It's still a high number though. And that's why we do this. That's why we educate people about medication safety. So prescription drug misuse occurs when someone is misusing medication that is either prescribed for someone else or when someone uses their own medication in a way that's not intended by their doctor. And it can affect all age levels. Regardless of age, there are many reasons why someone might misuse medications. It could be to fit in, and that's especially the case with adolescents. But it can also be used to get high, relieve depression or anxiety, deal with life stresses, to sleep better, or even becoming addicted to medication originally prescribed for pain. So whatever the reason, though, people often believe that prescription medications provide a legal and medically safe high since they are prescribed by a doctor. And the three most commonly misused classes of medications are opioids, your central nervous system depressants, which can be like your benzodiazepines or your Xanax, and stimulants like your Adderall for ADHD. So, and so insight prevention strategies for prescription medication misuse. So we use both the Lock Your Meds campaign and medication disposal efforts. So the Lock Your Meds campaign really encourages people to lock up their medications up at home to prevent prescription drug misuse and drug diversion. Drug diversion simply means that people might try to steal your medications to then sell to somebody else. And so this campaign is done through media outlets like billboards, news or radio ads, print ads, brochures, posters, and through the distribution of medication lockboxes, which we are able to receive funding for to give them out to community members as well as agencies for free. Our medication disposal efforts include partnering with law enforcement and pharmacies to have medication drop boxes or to promote those medication drop boxes. And this is so people can securely dispose of unused or expired medications. We also participate in take back events that are done by law enforcement. And those are usually done either during National Medication Take Back Day in the spring and fall, or they may partner with another event to host a Take Back Day. And that just simply means that you can bring your medications to the law enforcement agency or the table that they're having. Usually they have them at pharmacies or other places that they might hold events. And you can drop off your medications there. We also have Deterra kits and Disposer-X packets, which are at-home medication deactivation kits. And I don't know if I'll be able to show this or not, but that's what a Deterra kit looks like. And basically what you do is you put your medication in there, up to 45 pills, liquid or patches, and you put a little warm water in there, seal it up, and it deactivates the medication. And then you can toss it in your trash can. Okay. This is just another example of the Lock Your Meds campaign and what you might see on social media or on a billboard. And so how can you help? The first thing to do is to talk with your doctor about your medications. It's important that you advocate for yourself and your loved ones, whether it's your child or your caregiver for a parent or another loved one. Making sure that if they are prescribing a medication, that it's the lowest, most safe and effective dose possible, especially if you might think that you are more prone to addiction, maybe it runs in your family. You need to advocate for yourself. There are alternatives to opioids, and you are able to ask for those. Number two, make sure you properly secure and monitor your medications. So locking them up in a medication lockbox like this. We have various sizes of those available, or in a locked cabinet, making sure they are out of reach for young children especially, and older children as well as adults. And then monitor your medications. Make sure every few days you are making sure that the proper amount are still in the bottles that you have them in. Next slide, please. Okay, next you can safely and properly dispose of any old, expired, or unused medications, like I had mentioned before, with the deterra kits or at a drop box. We don't want to flush your medication down the drain because it gets into our water system and we don't really know how much is being filtered out. So we never encourage people to do that. If you don't have a deterra kit or if you're not able to get to a local drop box, you can always use something like kitty litter or coffee grounds to dispose of them, just to make them not usable anymore. And then educate yourself and your family. Share this information with your family, your friends, your coworkers, anybody who will listen. It's important information. Go ahead. And then you may want to take a screenshot of this, but I believe the slides will be sent out as well. So this is the Lock Your Meds North Carolina website. And if we have time, I think we're going to just visit that website in a second. So this is just some Lock Your Meds data, which pertains to the partners area that we cover. So Iredell, Yadkin, Surrey, Davie, and Forsyth. And this was from July of last year through June of this year. So the Lock Your Meds campaign has reached over 121,000 people through things like billboards, social media posts, through lockbox and disposal kit distribution, through in-person and virtual events and presentations. And so we've given out almost 10,000 rack cards, over 1,300 Lock Your Meds magnets, and 6,500 lock boxes and 12,000 disposal kits. And that's our contact information. If you have any questions or you need to contact me, I'm on the bottom there, Regina Probst, Program Manager. And then I think I'm going to share my screen if we have time.
Yes, I'm going to stop sharing and Regina, you go ahead.
Okay, can you see that? Yeah. Okay, so this is the Lock Your Meds website, and I am going to try and share a video real quick. So it has a lot of great information on here. I would encourage you all to check it out. So this is just a short PSA that Lock Your Meds developed and that we share on social media and other outlets.
It's not for everyone, only for you. The medication your doctor prescribes is exclusively yours to take as directed. Nobody else should be taking it. It's up to you to keep your medication secure and to safely dispose of any unused medications. Don't let anyone take what's yours. Your prescription, your responsibility. Be aware, don't share. Lock your meds.
Okay. And then if you all are in counties that I did not mention that Insight covers, can you see this next page, Beth? Okay, good. You can come to Get Involved, which is at the top there, and then just scroll down. And I won't say every single county is on here, but I think most of the counties are on here. And I'm not sure exactly how up to date it is, but if you try to contact someone in your county. For example, I know Burke County is a partners county that we do not cover. You can reach out to this person here. If you're not able to hear back from them, you can go up here to Holly at impactcarolina.org. She manages the Lock Your Meds campaign in North Carolina, so she can get you the most accurate contact information for the county that you work in, for the provider that can give you lock boxes or disposal kits, or they might be able to send them to you herself. So, and I think that's all I had. Thank you so much.
Thank you, Regina. I am going to pass it back to, no, we're going to do questions. If anybody has any questions, please feel free to put them in the Q&A. And if not, if you have a question that you would like to speak, please raise your hand and I can unmute your mic. And we will move to questions. Yes, Anne.
All right, I want to make sure that our attendees have time to ask questions, but if not, I have a couple that have come up with members that I've spoken to just over the last little bit here. So I thought it'd be good to share those questions. So is there anything in the Q&A that we want to look at first?
There is not.
Okay, great. So my name is Ann Gluff, and I am a member engagement supervisor here at Partners. And my team covers kind of the lower half of the counties that we cover: Cabot, Stanley, Union, Gaston, Cleveland, Lincoln, and Rutherford. And Beth, who is also here with us, she's our Zoom guru. She covers the top half of our counties, the rest of them. So some of the things I've talked to members about recently is if I'm, and I guess, Karen, these questions are for you. If I'm a member, I walk into the pharmacy and I'm picking up a prescription for myself or maybe for my son or daughter, and I know that I or my son or daughter shouldn't have to pay a copay, but the pharmacy tells me I have to pay a copay. So what do I do? Do I pay it? Do I not pay it? And how do I get that corrected?
So thank you for the question. So in the event that happens and you've not previously been paying a copay, a couple things. We can get you reimbursed. So if you are able to pay the copay so you don't have an issue at the pharmacy is not going to be able to edit it to really change the copay. If you let us know at Partners, we can check into it and see. We did have at launch a few issues where members were put into the wrong category, if you will, or group, and those groups are what assign people either the standard copay or the exempt, the $0. And
Got
so
it.
if that happens, you can make us aware and we can check on those and see what happened with that. We can have it reversed behind the scenes, and our pharmacy benefits manager, CVS, can actually issue payment back to the member or the guardian or legally responsible person, LRP in that case. We have diligently went through all of those different categories. The state updates them periodically. I've went through to recheck those to make sure that that is not something that happens. That was something we had an issue with for a number of members at launch in July. I've not heard a lot about any further issues with that since that initial July launch, but that would be the process. We'll get you reimbursed if indeed it was an error.
Wonderful. So if I'm a member, the best thing for me to do if I'm having an issue with that copay is to call Partners.
Correct.
And I'm going to call member services. And I just happen to know that number, 888-235-4673. And one of our customer service agents are going to be able to help you with that. And the other thing I wanted to throw out there is, what if I receive a letter in the mail from Partners and it's denying a medication, and it says in the reason it says that it doesn't meet best practices. What does that mean?
So North Carolina Medicaid has designed what they call clinical criteria. So that's basically written rules for when this medication can be covered for this and all the different scenarios to where you can cover a medication, whether it be a disease state or a specific need for a member that they've tried other medications that haven't worked. And so there's only, those letters are templated, they come from the state. There's only certain things you're allowed to put in them. So they are not personalized. They are not real easy to read. And I apologize for that. And they don't, so when you get them, they seem, kind of like a form letter, not very exciting. But what that means is that whatever's written in that criteria, when it was reviewed to be approved, there's something missing from it. Sometimes it's just that the prescriber hasn't filled it out entirely. I'll be honest with you, we're 70 some days since launch. And now that I'm able to go back and kind of see what's happening with them, a lot of times it's because these forms have a lot of questions to check or answer. And sometimes a question or a section is missed. And so we have to ask for more information. We have a very tight turnaround time for when we have to review those. So sometimes those letters go out while that information exchange is still happening. So once again, if you're concerned about, you think something should have been covered and it was not, please outreach and we will look into that. We do have an appeals process that's listed on the bottom of those letters, but you will see things like the criteria may not be met, more information is needed or things like that on those types of letters. So we are here to help and support with that, but we do have to follow the rules that North Carolina Medicaid provides for us for that criteria. I hope that was helpful.
Very helpful. I personally have received the letters for my own son, who is a Medicaid recipient. And so I completely agree with you. They're not personal.
Yeah.
Sometimes the wording doesn't make sense. And so, calling partners or talking with your care manager, if you have a care manager, is going to be really, really helpful. And I have one last question for you.
Mm-hmm.
So let's say my doctor that my son's been seeing for a long time, and he's in the network. He writes a script for his medication, but it doesn't go through the pharmacy. Maybe I go to the pharmacy and they're telling me that it can't be filled. Is it the same process? Do I go ahead and call partners to find out what's going on, or is that pharmacy able to kind of remedy that?
So I want to make sure that I'm understanding the details of that question. What's the pharmacy telling you as to why it won't go through? That is because of the prescriber?
They're saying that there's not enough information in the, I've heard that one, in the system, or it could be the prescriber, either one.
Okay. So in terms of the prescribers, right now for prescriptions, all prescribers who are credentialed with North Carolina Medicaid can write prescriptions for Medicaid members. So that means anybody who can prescribe that's credentialed with the state in entirety. That works for partners, that works for any of the standard plans or the tailored plans, right? So the network, whether or not they're in partners network, that's something separate. But for pharmacy, they can prescribe prescriptions, right? So it should not be, they should not be denying. The only time we should get something where the pharmacy might tell somebody, oh, your prescriber's not listed with Medicaid, should be when the prescriber is really not listed or what we call credentialed with North Carolina Medicaid. North Carolina Medicaid credentials all providers. That's prescribers, your doctors, that's your pharmacies, that's any type of provider that provides services. They're their credentialing body for all of us right now. And so that should be the only time. We did have some issues initially with launch where we had a bunch of prescribers showing up where it said they're not enrolled in Medicaid, but they were. And it was a digital file issue that was corrected once we realized we saw them there.
Right. Thank you so much, Karen. I
Absolutely.
really appreciate your level of knowledge. You are absolutely the subject matter expert for us here at Partners. So thanks.
Thank
I hope those questions were helpful to you. Again, those are just things that I've heard talking with members. And I know, our folks, our members have a lot of things to deal with. And so the last thing you want to deal with is going into the pharmacy and not being able to get your medication. But here at Partners, we are here to help you. So I really encourage that you, one, reach out to your care manager for assistance, or to our member Partners Access Member Services line, and we're happy to help.
Okay, I'm going to encourage anyone that has any questions to please put that in the Q&A or raise your hand, and we can get those questions answered. And while we are waiting on any potential questions, I'd like to share the our pharmacy website. So give me just a moment. Can you all see my?
Yes.
Okay.
Yes.
All right. So if you go to www.partnersbhm.org, and you can scroll down and click our tailored plan website, and then go to our pharmacy page. There's a lot of really great information on this page. It talks about North Carolina pharmacies, the DHHS web page.
Beth, if you'll stop there,
Mhm.
if you'll notice right there in the middle of the screen, it says Partners Pharmacy Processing Information. In the event you do not have your card and you present at a pharmacy and you're not sure, they're like, we don't know how to process this. This is the information that's on the back of the card that isn't real meaningful to most of the people in the world, but it's real meaningful if you're a pharmacist and you need to make a prescription, get a paid claim. So this is the general information for partners. In the event you or a loved one move plans, this information for partners and all plans is available on DHHS's website as well. So all of the call center numbers, like the help desk for the pharmacies to call, and all this processing information is readily available.
Thank you, Karen.
Mm-hmm.
Also, frequently asked questions, and then quick links. So please take a moment to go visit this webpage. Very beneficial, has lots of really great information, and will help you navigate the pharmacy system. Okay. We are coming close on time. We don't have any questions, but I'm going to pop it back to you, Stacy, and we will try to run through some of these slides very quickly for the remainder of our time. Give me just a moment.
Got it. And again, thank you so much to both Regina and Karen. You guys brought so much knowledge to the Member Cafe today. I hope everyone was able to get something from what they had said. And I definitely have seen insight at different events as we do different community events together. So they have definitely been out there passing those things out, making sure our communities have what they need. All right. So Partners is a local management entity or managed care organization, which is a specialized health plan. You can think of it as an insurance plan for North Carolina Medicaid and state-funded services. We manage a network of providers that specialize in treating mental health, substance use disorders, and intellectual or developmental disabilities, and traumatic brain injury that now includes physical health and pharmacy for those who are members of the Behavioral Health and Intellectual Developmental Disabilities Tailored Plan. All that means is now we have a whole person approach, physical health and mental health, all under one umbrella for those who have the tailored plan. We are excited to say that tailored plans have successfully launched. We all know nothing is perfect. When something new begins, there are questions and concerns. I'm proud to say that our partner team has been hard at work, helping our members and providers with all the new details. One place to get a better understanding of all the changes is the partner's website, and Lee has put it in there probably several times for you guys. It is www.partnerswithanSBHM.org. It is a great resource for you. If you have questions, we recommend you select the tailored plan frequently asked questions. So the next one, member ID card. So primary care physician or primary care provider, which you will hear me say PCP moving forward, information. Pharmacy phone numbers for members or for the pharmacy, and it's listed there. And member and recipient service number. If you want one number to remember, this is it. Partners Member Connect, that's the member portal. Create a login. You will need your member ID number for that. There's a 24-hour nurse line for tailored plan members, TP members, a 24-hour behavioral health crisis line, and that's for anyone who might be having a crisis, Medicaid or no Medicaid. Prescriber services for your doctor or medical professional that prescribes you your meds, and then provider services for your doctor's office or therapist, counselor, et cetera, to call and ask questions. Just some important numbers and things for you to remember and keep up with. So the member and recipient services, remember again, if you want one number, this is it. They can assist you if you have questions or they can get you straight to the specific number. And I know Lee is dropping it into the line for us. Remember, recipients is Monday through Saturday. Behavioral health is 24 hours, 7 days a week. We do have a non-emergency medical transportation NEMT schedule for your appointments. And so please make sure that you reach out to those 48 hours, 2 days before, business days before your appointment. First-time callers, have your Medicaid ID number when you call to schedule, have your address of your appointment and time and the address of where you want to be picked up. Nurses line is a 24 hours, 7 days a week. Get your answers to basic questions or concern about health, symptoms, or medicine. And then you have your pharmacy line and your provider services. So the pharmacy, again, 24/7, and then the provider services is Monday through Saturday, 7 a.m. to, I think that says 5 p.m. 6 p.m., and that's for providers.
AC, I have lost some of my screen, so I'm just gonna move on for the sake of time to
No worries.
the end of the deck. So give me just a moment.
Okay.
Can you see that?
So I do see that. So stay in touch with us. It is important to stay in touch with us. Please keep your contact information as we may need to contact you about your health plan. If you receive Medicaid, call your local Department of Social Services, so your DSS office, to update your address and phone number. DSS shares that information with partners and other MCOs or LMEs on a regular basis. They also may need to contact you about your Medicaid by mail or by phone, so please keep that updated. If you receive state funds, please keep partners or your local MCO up to date. Here at Partners, call the Member and Recipient Services or the Partners Access Line, and that is at 1-888-235-HOPE, so 4673. Want to be in the know? Then stay connected with us, and we'll keep you updated on all the things that's going on with Partners. If you want to stay connected, just go get your camera, cover over the QR code with your phone, hover over the code and then click. When you see the link come up, just tap it with your finger and it'll pull up how you can stay connected with us. If you're not quite QR code savvy, it's okay because we also have the link listed there, and I know Lee is going to drop that in for us. Your feedback is truly important to us. It helps us plan for future sessions, improve our presentations, and learn what topics interest you. Please take just a moment, only 4 to 5 minutes, to complete your survey. To quickly get to the link, you can hover over the QR code with your phone's camera and touch the link that pops up on your screen. Again, if QR codes aren't your thing, that's cool. Then click on the link that I know is there in the chat. You can highlight it and copy and paste it into the website, and that will help you to be able to provide us with the feedback. And I know Lee has been amazing with putting that stuff in the chat for us. Does anyone have any additional questions for us before we close out today? Last time or forever hold your peace. I'm just kidding, because we have provided you with different options to reach back out to us. If you have additional questions you might didn't want to ask during this time. Again, we appreciate you for attending Members Cafe today and for sharing your time with us. As I mentioned at the beginning of this session, we have partner staff available for individual issues you may want to discuss. You can reach out to the member engagement team by sending an email at memberquestions@partnersbhm.org. Next month's Member Cafe will focus on Down syndrome with a focus on ability. Please do take a moment to complete our survey. Your feedback is important to us. And again, thank you so much for joining us, and we look forward to seeing your beautiful and handsome faces again next month at our October Member Cafe.